Hello, hello. Good to see you all. All right, everyone, as you are coming in, I would love for you to put in the chat where you are coming in from in the world tonight. Awesome. We got California representing, Texas. Heyo, you got some Boston folks there, Dr. Casano. Virginia, lots of California tonight. I love it. Florida, great. Colorado, Connecticut. Hey, New England. Arizona, a town called Goodyear, Arizona. What a great town. Hey, we got Hawaii in the house. Amazing. Chicago, great to see you. PA, what's up? Awesome. Kentucky, you guys had a big week in Kentucky. All right, team. Dr. Casano, are we expecting Joshua?
I guess so. Is he around already?
Looking for him in our panelists and our attendees to see if we can pull him in.
Let me see. It says that he can sign in.
Interesting. Is he using a different email than that NearX email?
He should be using the Nerex email. Let me ask him.
Yeah, great question in the chat from our Restore team. Who here has tried red light therapy? Oh, we got lots of hands going up. I love it. Almost daily for 2.5 years. All right.
We have some pros here. You guys have a lot of experience.
Used it many times. Amazing. Awesome. In PA, using it all the time. Look at all those hands that are up. I love it. It's terrific. All right. Well, as we wait for our second guest to come in, I am going to get started on some intros and some housekeeping because I am so excited about the topic tonight. And I am just so thrilled to have some of the brightest and leading minds in this space here with us tonight. Team, we are in for an incredible treat. There we go. Hello, Joshua. Wonderful to see you.
Hello. Hi,
Ab-
Rachel.
Hello. Absolutely thrilled you are here. All right, let us get going. Everybody is in the house. All right, team. So here's what we're going to do. We love to keep these webinars really conversational. We have a deck to guide us. We're going to give you some amazing information, but I'm going to keep the chat open the entire time, and feel free to go ahead and put your questions in as they pop up, and I will forward them to our incredible guests. All right, so let us get started to brightening your mood and thinking about how we can use red light therapy specifically for mental health. So I just want to welcome you. I'm Dr. Rachele Pojednic. I am so thrilled to have you every month right here for our members only night. This is a huge thank you to our members at Restore, and it's an exclusive benefit to Restore members. So you might have friends that come to Restore, and if they are not members, they do not get the link to this webinar. And the thing that I love about this webinar every month is that we bring you the foremost experts on the topic of the night. And I can tell you the two folks that we have here tonight are just literally leading the field in this space. And I could not be more excited to talk about how red light therapy, photobiomodulation is going to affect mental health, and they are running incredible labs and doing some incredible innovation in this space. So you can come here for the science-backed education and get direct access to these amazing experts. So we thank you so much for your membership, and we are thrilled to have you here. So as I mentioned, I'm Dr. Rachele Pojednic. I am the Chief Science Officer here at Restore. This is my bio, but it pales in comparison to the bios of my esteemed panel members tonight. I am the Chief Science Officer here at Restore. I also have a faculty appointment at Stanford, and I do a lot of work in this space of supplementation, muscle health, and human performance and healthy aging. My first guest here tonight is Dr. Paolo Cassano. Dr. Cassano is a Harvard-trained psychiatrist, neuroscientist, and co-founder with our second guest tonight on a company called Neurax Inc. And you're going to get a sneak peek into their cool technology. He specializes in non-invasive brain stimulation and light-based therapies that support mental health and cognitive function. And if you look here at his credentials, you can see it is absolutely amazing. He's the director of photobiomodulation at Mass General Hospital. That's in Boston at Harvard Medical School. He has over 15 years of research in light therapy, specifically with mitochondrial function, which we're going to talk about tonight, and using light therapies, photobiomodulation, to focus on solutions for depression, cognitive decline, chronic fatigue, much of which you all are coming into Restore to address. And as I mentioned, he's the co-founder of Neurax Inc., which is bridging the clinical science with wearable innovation. You're going to be able to see some of their wearable devices tonight. And also advocating for natural, accessible, and personalized brain solutions. So Dr. Cassano, thank you so much for being here with us tonight.
My pleasure, Rachel. Thank you for having me.
Our second guest tonight is Joshua Chen. Joshua is I love this, neurofuturist. Like, how awesome is that title? Inventor and co-founder of Neurax, dedicated to advancing brain health through wearable light technology. He is the co-creator of the Neuro Espresso. I love this technology. A smart, light-powered e-stimulant for restoring focus and energy. He works in partnership with Dr. Cassano on these non-invasive brain wellness solutions, specifically looking at mitochondrial health and how to use photobiomodulation for cognitive performance. Joshua brings over 20 years of experience in developing forward-thinking tech for human wellness and is committed to redefining the future of mental clarity and energy regulation. So, gentlemen, Joshua, Dr. Cassano, thank you so much for joining us here tonight.
Thank you, Rachel.
All right,
Nice seeing everybody.
Just as a quick disclaimer, I am not a medical doctor. I am PhD, not an MD. So I am an educator and a scientist. And just to remind you that the information provided in this webinar is for educational purposes, and it's not intended as medical advice. Any of the suggestions or recommendations are based on general principles and may not be suitable for everybody. So it's really important, if you have a mental health condition or you're using some of these therapies to work through a mental health condition, that you are also working with your healthcare team. All right, so tonight we're going to look at, and I'm going to turn this over and field some questions to our guests momentarily. How does red light therapy work? We're going to look at some mental health statistics, the data on depression, and then we're going to look at some next steps as to what's going on with the Neurax and what are some of the therapies that we can use to help with issues like anxiety, depression, cognitive health, and using photobiomodulation like espresso, which I love. All right, so when we look at mental health, there are a lot of different ways that we can think about mental health. Dr. Cassano, can I start with you and just, can you give us the landscape of mental health in the United States? What are you seeing in clinic? When we talk about mental health, what are we really saying?
Yes. So first of all, we are post-pandemic, and the rates of anxiety, depression, and cognitive disorders have highly increased since the COVID-19 pandemic, and they have not come to baseline. So that's still a second pandemic that we are still experiencing these days. And that's a challenge we have, which is paired with another pandemic, which is a pandemic of loneliness in the United States. Our very individualistic society has produced these changes that are not conducive to mental health or brain health.
So as we're thinking about mental health here, can you talk to us how mental health and sort of like the physical components of health work together to contribute to overall health? Because this is kind of, as we're using photobiomodulation, we're really talking about using an external physical stimulus in order to help with mental health. So how do these two things fit together?
Yes, absolutely. Our health, our brain health is highly influenced from our body health. So chronic conditions like diabetes, cardiovascular conditions, and others, other body ailments influence our brain health. And how does that happen? Mostly it happens because of systemic condition like oxidative stress, like inflammation. You all might have experienced a day where you had a fever or and you had a kind of an infection, and you had the so-called sickness behavior. You kind of just wanted to do nothing, stay at home and rest, and really had no motivation, no energy. Well, guess what? That happens because of this systemic inflammation. And in chronic disease, those things are chronic. So physical health is essential to mental health. And also, it's true that even if you don't have a chronic condition, and we all know it, if we conduct a healthy life, our brain health and our mental health is better. Of course, we're better off when we eat well, when we exercise, when we sleep. Those are just the basics. So certainly they are interrelated.
And I know we're going to take a slightly deeper dive into this in just a few minutes, but you were talking in both of your bios about mitochondrial health. Can you give us a little preview of where we're going as to what are mitochondria, how do they affect our physical body, and how might they be affecting our mental health?
Right. So mitochondria are the powerhouse of the cell.
Don't you love saying that? Every time I love saying it.
Yeah, I hope that makes any sense to people. But literally, it's true that the cell can produce energy without mitochondria. And in fact, there are some cells that don't have mitochondria, right? The red blood cells don't have mitochondria. However, much more energy is produced within these very tiny organs that are called mitochondria, which are in the cell. Now, what happens? As we age, mitochondria slow down. They're not that furnace that they used to be, and they don't produce so much energy. So that's why we feel a little more cold, and if you notice, children can go out in winter in the coldest weather, and they're in t-shirt, and they seem to be fine. They're just producing all this energy. Their mitochondria are superpowers. And as you all, through inflammation, oxidative stress, the same issues, and also some mutations that happen, mitochondria happen to have their own DNA. They don't just work as well as they used to. And some technologies like infrared light and red light can in fact boost the function and restore the function of mitochondria. And also, to tell the truth, depending on how we conduct our life, whether we drink or we smoke or whatever we do, we affect overall the function of our mitochondria.
Got it. All right, so we'll dive a little bit more into how red light photobiomodulation can affect our mitochondria in this next section. So we're going to keep talking about the science of light. Now, I have to be honest, when I first started at Restore, I did not know that much about red light therapy. In fact, until you two really came into my world at one of our conferences and sat down with me and really showed me some quite impressive science behind different light therapies and particularly red light. So can we start with just generally talking about how red light therapy works? What is red light? What makes it different? What makes it unique?
Yes, so interestingly, many wavelengths, or if you wish, color of light, have the power of influencing the tissue activity. So, or other ways, biomodulate tissue. So that's why we use the word photobiomodulation. However, red and infrared light, and especially infrared light, penetrate through the tissue more than others. So there is a unique opportunity there. Also, their wavelengths are more likely to be absorbed by the mitochondria. So better penetration, more likely to be absorbed. And when the light gets to the mitochondria, it's literally a photosynthetic reaction. So this is
Like
the
plants?
astounding, like plants, that's the astounding truth that we've made so much of a distinction in between us and the rest of nature, but we actually absorb the light and make energy out of it, just as plants, like bacteria, like anything.
That's fascinating. So why does red light do that and not like blue light or green light or something like that? Do we know?
Yes. So the key aspects here is that the cytochrome C oxidase, which is um, what we call respiratory chain. So that chain of reactions that uses oxygen, and really literally the cell breathes through that to produce energy. So that respiratory chain has as its last reaction a complex called cytochrome C oxidase. And that complex is particularly affected by the wavelengths of the red infrared light. So that means that it's the light that they're more likely to absorb and more likely to derive energy from. So not only, as I said, it penetrates better, but it's also more likely to give energy to the cell because of this match.
Interesting. And so does that enhance the production of ATP then at this last
Yes,
component of?
absolutely. So ATP is a high energy molecule that is formed. It's that packet of energy that travels then in the cell and delivers the needed energy for any type of reaction. It's not the only one, but it's the main one.
Amazing. So I think this is probably kind of what you were just talking about, is that we've got all of these different, well, you walk me through this slide, you do it.
Yes, so as you can tell, even the other lights, the blue and the green, and they do affect the cell, and they affect the biology. However, the green and infrared light, when we talk about the brain, so the red and near infrared light are more likely to penetrate and get to the mitochondria. You see this little kind of sausage down there, that's the mitochondria. And once the light gets there, it's absorbed through the respiratory chain, as I was saying, and we have greater production of ATP. And then there is a cascade of other benefit.
And so when we think about this, oftentimes at Restore, we're often talking about it from the skin perspective, right? So it penetrates through the skin, but a lot of the work that you have done has been on transcranial. So getting the red light into the brain. So how does that work?
Yes. So the way it works is that, yes, most of the light is absorbed by the skin and by the superficial tissues. There's also a lot of pigment like hemoglobin, myoglobin, and also melatonin. I'm sorry, melanin that absorb light. And so because of that, only a tiny bit, like a 2%, reaches the brain. But that 2% of light over the surface, over the cortex of the brain is enough, in fact, to modulate brain function and also to energize the brain. In fact, it has been demonstrated in humans, in healthy subjects, that you can increase ATP levels by shedding the light on their forehead, and you can increase it specifically in the brain.
That's amazing. So it literally will go through your skull into your brain.
Yes.
All right. I've got some data that actually it was really interesting when we were doing and putting this deck together. We kept coming around and we knew you were going to be our guest, Dr. Cassano. We're like, oh, that's Dr. Cassano's work. Oh, that's Dr. Cassano's work. So you'll be able to talk about your own data in just a second. All right. So I'm going to turn it over to Joshua for just a second. Joshua, can you talk to me a little bit about this idea of espresso and how you think that the both transcranial as well as maybe some other ways that red light gets into and penetrates our system? And I know you're working on some wearables for this. Talk to us a little bit more about how you see this coming about.
Well, the company is about 8 years. So we spent the past 7 years and working closely with researchers and scientists, particularly Massachusetts General Hospital. And the more we learn, we found a photobiomodulation and affect the body through many ways. Directly stimulate the mitochondria, in the prefrontal area is one way. And also we find, and photobiomodulation also can stimulate some neural pathways. And for instance, the vagus nerves and the other, the circuitry. So even Dr. Casal just mentioned, this using a certain irradiance can penetrate deep, right? And 3 centimeter to the brain, but also some low dosage photobiomodulation, even on the skin surface, can affect the brain. And so we more and more we understand the body is like a big network, and like computer. So the CNS, the nervous system, just like the network, and the mitochondria perform like a transform also the signals. And so more and more studies shows if you specifically target one area, and even like on the abdominal area, and you can also stimulate the brain. So we have finished a clinical study with a Chinese Medicine University in Taiwan, and also the Harvard Medical School here. And we finished a depression study and the sleep study. So the study is being published by the Journal of Psychiatric Disorder. So the data shows amazingly, this even our headband is a low dose, about 30 milliwatt per square centimeter to 70 milliwatts square centimeter. So this is low dose, can effectively help promote better mood and better sleep. The better for sleep, and this is a significant different from the control group. So the idea, the neural expressor is coming from, when we ready to launch this product, the first MVP, this wellness product, we thought what we should focus and for the consumer, they can adopt photobiomodulation, right? Photobiomodulation is still new for many. Red light therapy, so many applications, but we like focus on the brain benefits and brain health. And so we come up with the idea, this photobiomodulation can promote better focus, right? Because stimulate mitochondria, and then the oxygenation, and then the higher the cerebral blood flow. So the focus concentration is the first immediate, and we can feel. And therefore you say, espresso and coffee and energy drink, and today has become more and more people consume a lot the stimulants, because we are in the era of attention economy, right? We need performance, and there's a lot of distractions. And however, those stimulants is not sustainable, right? We know the side effects of coffee and the energy drink, too much sugar, and prescription drug like Andorol, just definitely it's a lot of side effects. So photobiomodulation is the perfect stimulant. Can immediately, its immediate intervention can boost their focus without side effects. But our data shows it can promote better sleep. So actually, you stimulate when it's in the daytime, and you sleep better in the evening.
So it's like a big virtuous cycle. Yeah.
Exactly, it's the balance of the brain, right? And so that's so exciting. So obviously we say that this is a new type of next generation of a stimulant. So let's call this espresso. But before we want to call the Harvard espresso, because there's a Harvard soup. It's very, very famous, right? Everybody knows the Harvard soup is for the microbiome. So what about the Harvard espresso? So we eventually named this Neuro espresso, and we have already 100 people using it, and so far 90% people and feel this can help. And another interesting thing is we started our first generation 2019. We have 500 people beta testing group, and we followed this 6 years, and we have the report come out. That's an amazing report. And the 6 years, we still have 26% people using the generation 1, the headband. So this is just second to the medical wearable device. If you see the smartwatch or Fitbit, the fitness tracker band, is the 6 years is less than 10%. Smartwatch is a little high, 10 to 15%, but Fitbit is just less than 5%. And our headband is 26% people still using it. So which means it's really work. And the second, and this, I think people love it, because most wearable people put in the dustbin in 3 years. 65% wearable is in the landfill.
So I'm going to show a picture of your headband in just a second, but you mentioned something, and Dr. Cassano, maybe I'll come back to you on this one. You mentioned something about dose, which I think a lot of people have questions about. So Joshua said your headband device is a low dose administration. At Restore, when you come in, we have these big panels that one is in front of you and one is in back of you. We recommend that people take all their clothes off and get in between those big panels, and they stand there for about 10 minutes or so. So can you talk about kind of the effect size of something as small as a headband or something as large as a full body panel?
So is the question for me or for George?
Yes,
Okay,
for you.
sure. So so these are very well tolerated, and what you typically have in terms of I'm sorry, your question is about side effects, is that correct?
No, dose. So if we're thinking about dose,
okay.
so the little dose that you might get from a headband, the low dose, and then the sort of like major dose that you would get from standing in between panels. What would be the expected difference in those two?
Yes. Thank you. So there are no comparative studies. So that's really the first step here.
We should do one. Let's do one together.
Yes, absolutely. I'd love to. However, what we see in the clinic is that The low dose is working through daily treatments and usually also through exposure times that are somewhat longer. While the high dose works through treatments that are twice or 3 times per week, depending on how frequently the client comes into the clinic. And the exposure time is fairly short. Now, I will say when I talk about the low dose, I talk about devices such as the ones from Nirax that Joshua just discussed. Now, the high dose, it's a bit a complex group of treatments. One is the high dose that is delivered through the helmet. And that's in fact what we typically do in our clinics that are specifically related to brain disorders. But it could be the whole body, such as what you do. So those are different. The whole body is more of a systemic approach. And it is high, your dose, but also there is the distance in between the panel and
people are asking about the distance in the chat. Yeah, what's the deal with the distance? Yeah.
Well, it's fairly simple and complex. That is the fact that the light decay is exponential. So the more distant you are, the less effect you have. So in most of the cases, unless someone is really at contact with the panel, you're talking about rather a whole body low dose. If you're really in contact, then there will be some areas of your body that are, in fact, making contact, and those area only will be at high dose.
Got it. Got it. Don't go like hugging our panels now, team. Just
no, do what you do and what you know it's safe.
Okay, so let's start to pivot into how red light therapy can, as Joshua said, reduce stress, improve overall sleep. You mentioned the vagus nerve. How are we thinking about how this photobiomodulation, specifically with red light, can directly affect the brain? Like, what's going on there?
Yes, so this is very commonly seen that people who do the red infrared light during the day, they sleep better at night. And Joshua just alluded to the studies with the Nirax product that have shown, in fact, and demonstrated in a double-blind sham control manner that was true even with a low power headband type of device. There are several reasons. Some are related to the specific dose. So if you're using 10 hertz, 10 hertz is a more relaxing dose and could be very soothing. And if you're using at night, we found also that using it in the back of the head was even more calming. If you recall from other whether classes or else, the back of the head with the eye closed kind of defaults to 10 hertz in relaxation mode, and that's the occipital lobe. And so that's exactly what we would be inducing, and which favors kind of falling asleep and relaxation. But it's also true that through the light, you produce endorphins. And these endorphins, obviously, they are relaxing and producing some level of sleepiness, depending on how much you do. And that being said, I will say that if you use parameters that are more activating right before going to bed, you might actually have the opposite effect of people that are just up and on the go and might not quite feel like going to bed and sleep.
I was just going to ask that question. I'm glad that you call that out, is that there are reasons why you might use more intense or longer therapies or in a different part of the body to have that espresso effect, as opposed to some of these, as you mentioned, the 10 hertz at the back of the neck in order to induce sleep. Okay, so I've got a follow-up question from this, which a lot of people are asking in the chat here. Joshua, I'm going to turn this one to you. Are all of the devices that we are seeing all over the place equal? As in, if I go to Amazon right now, I can find a device that is definitely red for $29.99. And is that doing anything? Are all red lights created equal?
No,
No.
definitely not.
I didn't think
Definitely
so.
not.
I had to give you a softball.
Yeah. Well, it's just like you go to you can buy disposable syringe, and then you tell me, and all the syringe doing the same thing. You need a dose, you need ingredients, you need medicine inside, right? So the more we learned the evidence from the study, and the more we believe the personalized dosage and the parameters, and particularly in a personalized precision way, is the future of photobiomodulation. You know, one thing we can tell, you know, this is obvious. If you say a big panel is just photobiomodulation, give you all the benefits, and use the study from Harvard, from a Texas University, or whatever, all their benefits my panel can deliver, is not true. Because you just set out understanding the sunlight, and you suppose can treat all the problems, right? So it's not true. You know, Dr. Cassano's study already proved the high dose is no difference than placebo, even worse than low dose. So there is this, we call it a sweet spot. You know, you need to find a sweet spot. So therefore, you know, near us we launched a AI powered app. It's called a ThinkWell. So the user, so any start, you know, just beginner or any clinician interested in photobiomodulation, and they can learn, because our agent called NERA learned over 600 published study or peer-reviewed study. So they learn and still learning. So you can use AI agent to understand. So what a personalized dosage and you should use, particularly with our headband, right? And then you can use your Apple Health or Google Health and synchronize with a pair with our ThinkWell. The more NERA or ThinkWell learn about your personal health, and the more, you know, the more accurate, precise the dosage it will suggest.
I love that you're bringing that up. This is something that we're exploring in a major way as well, is how to get feedback to our clients based upon the technology that they are interacting with in the studio. Red light is one of them, but we've got many. And really thinking about how to personalize the experience. I think that's so important as we start to talk about how to use these therapies. So I just put your studies up there about sleep and depression. What's going on with depression, Dr. Cassano? How do we think that red light therapy might specifically be addressing some of these mental health issues? So sleep, we've got that data, we've got this espresso effect, but depression is a really different kind of mental health state. So can you talk a little bit about how photobiomodulation might help there?
Yes, we're conducting several studies at MGH on depression and light therapy. So what we have demonstrated, and Joshua was alluding to this, that there is a dose-dependent effect in people who suffer from depression. So meaning that we can modulate cerebral blood flow and brain oxygenation with the different doses. Specifically, the medium dose has the greatest effect in boosting cerebral blood flow and brain oxygenation. So that's very important, because depression, like many other brain conditions, is associated with brain metabolic deficiencies. So by restoring cerebral blood flow, you are likely to offset this abnormal function and kind of fuel the brain with more energy and normalize. We have seen in the very first pilot studies that the medium dose was also not only improving brain blood flow, but also improving the depression severity scores. Now we are conducting a double-blind randomized study to test over 8 weeks that same dose that was helpful.
And so when you say that dose that's delivered transcranially, and can you describe that dose a little bit more?
Yeah, so it's delivered to the forehead. It's delivered bilaterally, and usually, although irradiance is not the only factor, it's a dose that ranges in between. It's around 250 milliwatt per square centimeter, and it's over an area of 24 square centimeter. On 12 and 12 on both sides.
Got it. And how long are they getting this therapy for?
Yeah, and they get the therapy in between 6 and 10 minutes.
Okay. So you've got some other data that we have sort of cooked up here as well. So depression is one issue, and then also anxiety is another that is being demonstrated that might be improved with photobiomodulation red light therapy. So again, depression and anxiety often work together or come together packaged, but not necessarily. So how do you expect the photobiomodulation to be working for anxiety?
Yeah, no, absolutely. There's much less data on anxiety than there is for depression related to photobiomodulation. Primarily, it's about boosting the prefrontal control, which kind of dampens down the hyperactivity of the amygdala. And so kind of that balance in between prefrontal cortex and amygdala. So by boosting the activity of the prefrontal cortex, you have that beneficial effect on fear and anxiety. What is also interesting is that in subjects who had traumatic brain injury, we've noticed that due to the common comorbidity with post-traumatic stress disorder, that PTSD was remarkably improved, and those are the data of Marnie Nazer group at Boston University and VA.
Interesting. I did notice, and I just want to call it out in the chat, that a lot of people are asking about TBI here as well. And you mentioned PTSD. I feel like these kinds of diagnoses often are sort of intertwined. Can you talk a little bit? It's not in our deck here, but just there are so many people asking. And I know, Joshua, thank you so much for answering so many questions in the chat. Can you talk a little bit about TBI while we're kind of in this vein and how we think it might be working for traumatic brain injury?
Right. We have recently completed a study at MGH on acute TBI, and the data were surprising, to say the least. This was a double-blind, sham-controlled study. People were coming to the emergency department, and they were randomized to receive 3 treatments within a week or no treatment, and then they were followed over time. The no treatment was a sham treatment. And over 12 weeks, what we've seen is that, which is somewhat understood and well known, I should say, that traumatic brain injury leads to a neuroinflammation and to kind of a neuronal wellness compromise. And however, the people who received the 3 treatments right after the acute TBI, they didn't show that. They didn't show the neuroinflammation. They didn't show the neuronal compromise. And so that's very interesting, very promising, because in the future, PBM could become an acute intervention in cases of TBI. Most of the data for TBI is related to chronic TBI. Of course, that's kind of easier to enroll, and there are several open studies, uncontrolled studies that have shown quite remarkable benefit in terms of visual memory, attention, concentration, executive functions. But again, there was no control.
Interesting. So you're seeing sort of like a neuroprotective effect. I know people in the chat are asking about cellular turnover and whether red light can have an effect on that. But you're talking about something a little bit different here with the neurons specifically.
Right. There well could be a neuroprotective effect. In fact, we know that the first heat is just one of it. What's kind of the one of the issues in TBI, and then part of the damage is related to the excessive inflammation and oxidative stress.
Interesting. All right, so we've talked a little bit about cognitive function. So this is executive function, this is memory, processing speeds. You have some data to show that this could potentially be a helpful therapy for people that have mild cognitive impairment. So maybe people that are showing signs of cognitive decline, perhaps leading to something like dementia or maybe even Alzheimer's in the future. What's going on here? This was a study when I first saw, there was a particular study. I think this was the one, there was a helmet and like two things that went up the nose, and they were shining the red light up people's nose. And they really saw improvements in people that had pretty advanced cognitive impairment. So what's going on there?
Yes, no question. There are now more and more studies that are done on mild cognitive impairment. Oftentimes referred to one of the first stages of Alzheimer's, symptomatic Alzheimer's disease, then progressing towards dementia. And data are encouraging. There are not a lot of data that are controlled and sham controlled in this field. We are just about to conclude in 6 months from now a large multi-center trial at MGH with affiliated centers in the nation, exactly to answer this question. So we're itching to have the data, but certainly so far, the data available suggested that, in fact, it could help all of this dimension you just listed here.
So interesting. All right. This one got me, and we had to put the sexy picture of the guy with the headband on, Joshua, for this one. So this is your study, Dr. Cassano, and then I'm going to turn it over to Joshua so we can talk to us a little bit about your technology here. So this is the headband that you have all been talking about with NearX. First, this one, we were like, we had to put it in, right? So tell us a little bit about how red light could improve sexual dysfunction. Say more, Dr. Cassano.
Yes, so this is a study that was in fact double-blind and sham-controlled, and we actually did not expect at all to see this, but we're intrigued by some comments that the patients were doing, and then we went to analyze the data, and we found that it's not uncommon in patients with depression, whether it's due to the depression or the side effects of the medication they're taking, that they might have sexual dysfunction, and that was reversed over the course of the trial. Most of the time you see an antidepressant effect, but you don't see effects in certain dimension like the sexual function. So that was really surprising, and we're certainly interested in replicating that, but we haven't yet run a trial to kind of test the hypothesis. What we know from the clinic is that differently from other interventions like antidepressant medication, like SSRIs, we don't hear patients complaining of sexual dysfunction. So at the very least, if it doesn't reverse an impairment, it doesn't cause an impairment.
Interesting. Yeah, that's fascinating. All right, Josh, I'm going to turn it over to you. This is your device. So walk us through what we're looking at here and how do you use it?
Sure. I would like to show you the actual product of Nero Espresso. And so this is how Nero Espresso packed.
Close to the camera with the background.
Oh, okay, that's interesting. Very futuristic. Okay. So this the product, the pack come with a carrying case. So the idea is we want people carry this just like a mental toolbox. Okay, the mental toolbox. You can carry this and you use it when you need it. And so it's come in with the headband and then the control pod. So it's pretty simple, pretty easy. So without, it looks just like a street headband. Okay, and no difference like a street headband. Just wear it, and I know there's some athletes that really enjoy wearing this on the street. Yeah, this is a good-looking street headband. And I'm looking like a sushi chef and not the athletes, and just and this come with a control pod, and you just set parameters. You set parameters, frequency, duty cycle, timer, and everything can manually set. And you can use ThinkWell over AI aging to learn personalized setting. And you just tell, well, my sleep is not good. How can I use it for sleep? And then it will tell you how to set the parameter where to use it. And then you sell accordingly. And plugging any power source, we have a power source around us, right? Phone charger, computer. When we in the cabin, there's a USB power everywhere. So you just plugged in, and then you start use it immediately, and it's quite simple. Yeah, and one thing you mentioned, you asked about anxiety. As Paulo said, you can stimulate the prefrontal. Also, you can stimulate the vagus nerve. You just wear like collar, and for 5 minutes, and it perfectly relax you, and can calm down, and relax. And for anxiety, it could be the perfect intervention, and you can immediately get released.
It's so interesting to think about how all these technologies can work together. If you can't come to we did have one person in the chat very much in the beginning, but maybe before you got here, Joshua said that they've been getting red light therapy every day for 2.5 years. But oftentimes we see that, coming to the studio 2-3 times a week, that's awesome. But what do you do if you want to fall asleep on those other days? This could be a really terrific way to continue to have those therapies, or to have them specifically for brain, or in times like when I want to go to sleep, right? So as we're looking at red light therapy kind of across the board, and then we'll take a couple of questions here as we end the hour, it does seem to be that in addition to all these mental health and outcomes, and Joshua, you mentioned this a little bit in the beginning, that we are seeing so many benefits emerge in the literature on skin health, which is a pretty traditional utilization for red light specifically, but also things like muscle recovery, pain management, vision, menstrual symptoms, hair loss. Can you talk, maybe both of you, a little bit about what you're excited about with this field and where it's going and what this therapy could potentially be used for?
Paulo, you want to start first?
Okay. I think, yes, there are a lot of cosmetic benefits, and that's important, certainly, because, when we look good, we feel good. And so there's no question that it's important. But at the same time, there are challenges that we all experience as we're aging. So the cognitive performance, as you get to be in the elderly phase, is not the same as it used to be, and the muscle performance is not what it used to be. So we face real limitations, and the fact that we can constantly rejuvenate our body and keep up, it's very exciting. It's kind of an extended youth and extended productivity, enjoyment of life. I'm very excited about prevention. And although our research is in brain disorders, the idea that we can move to wellness and prevent and also work on longevity is very exciting to me.
Awesome. Joshua, what are you excited about with this field?
Yes, I've been in light therapy for almost 2 decades, 25 years. And 20 years ago, I was fascinated because NASA used red light in the space center and help healing the wounds. So this is red light coming from. And then 10 years later, red light therapy has been FDA approved, cleared, and for hair loss and for hair growth. And then we see the red light can for muscle recovery, FDA approved, and pain relief and FDA approved. So all this actually from the because red light of near infrared light working on the cellular level, right, and on the fundamentally mitochondria. The most illness is because the mitochondria dysfunction. So theoretically, is fundamentally is red light the application is limitless. Okay, it's limitless. And you even see the red light using the aquaculture. I use red light, and I bought a little red light device and treat my plants. I have some potting plants, and I treat potting plants when the leaf is yellow. It really works great. So because
good to know. I'm terrible at keeping my plants alive. Maybe I just need a little red light to keep them alive.
You just it works perfect. Plants has a mitochondria too, and so it's proof. It's only the red light or photobiomodulation is the only stimulation working directly to the mitochondria, not the current, not the magnetic field. Is the light. And so in the future, our vision is we know this mitochondria come from sunlight. This is natural, right? Paulo mentioned 70% of light is near infrared light. But because the human civilization, we wearing clothes for thousands of years, and the clothes block the light, particularly near infrared light. So our vision is very intuitive. We build the future clothing and which protect from UV light, but emit the light we really need.
I love that.
Yeah.
Great.
But
so we're going to wrap it up here. We are at the hour. I think that you've answered many of the questions that are in the chat. And Joshua was really good about answering them in real time, writing down answers. So I think the majority of the questions were really around dose. They were around, what's the intensity that we should be having? And you answered that really well. Is there anything that you would like to sort of leave our members with as just, parting knowledge of how to use red light therapy and what you think they should be really doing with it?
Paulo?
Well, sometimes you need to try different doses in order to get to the benefits you're looking for. So stick to it, play with it, and of course, get guidance from your treaters. And I'm confident that you'll find quite a lot of benefits.
I love you just said the word we've been using a lot lately is consistency, right? This idea that if you use a therapy regularly, you're going to experience much more benefit than just using it as a one-off. Joshua, what are you telling our folks? What should they be thinking about how to use red light and how to apply it to mental health as well as other issues that they might be dealing with that you think red light could help them with?
Mm-hmm. You know, sunlight is everything. Sunlight is our, giving us life. So enjoy the sunlight. And for red light therapy or photobiomodulation, and I really suggest people, and don't be attracted by the pricing or the design of the product, and or some testimonial on Amazon, and trust professionals. Trust the studies, trust Restore, and trust the managers and the staff in Restore, which been trained, learned. And because, if you, now we can see like a sleeping bag with thousands of LED, you just slip in and then there's a foot. I think this is ridiculous. This is ridiculous. And that is too much heat actually reduce the effect of photobiomodulation. And the smart way is just like acupuncture. Acupuncture never put 1 million needles on your body. It's just 0.1 actually. You sometimes they put 0.1 feet actually, to target your brain. So that's the way, because the whole body, the neural pathway, we need to find what's the neurons joint and find that circuitry which you stimulate this area and then can affect another part of the body. So the smart photobiomodulation based on the AI development, based on the wearable like clothing, I think is the future and is happening really quickly. So once that ready, I think when you see the market, this is a chunk, the big chunk of the device, a lot of device of, I think that will become obsolete because the light will come back to the wearable, and the light, you can have the light anytime and anywhere. It's just like clothing.
I love it. I am so grateful for you both for coming and sharing your wisdom. Joshua, I am going to double tap on what you just said, is to trust the experts, stay with us on the science. There is a lot of hype out there, and it's one of the things that I love so much about bringing you all, the experts in the space, to talk to us about what's real, what's not real, what should we be doing, because it gives us confidence in the way that we are able to use our therapies. So thank you both so much for being here. If you still have questions, please send us a note. I am going to be doing, without Dr. Cassano and Joshua, another Instagram live on Friday. So check it on out. We will answer more questions. Bring your friends in. We will talk more about red light therapy. And if you want to dive a little bit deeper, you can look at all of our therapies and our podcasts and the knowledge that we have been gleaning from the experts. So thank you so much. I'm double tapping on it again, triple tapping now. Trust the experts. Thank you so much for being here. We're going to talk next month about NAD and NR, which are great therapies in complement to our red light therapy. So make sure that you are registered for next month's event right here on the members only night. And this is my favorite part, Dr. Cassano and Joshua. This is our tagline that we sign off on, which I love to say, restore.
Love it.
Thanks so much and have a beautiful evening. We so appreciate the experts coming and talking to us, having direct application and answering of questions to everything that we're talking about with our therapies here at Restore. So thank you so much, Dr. Cassano. Joshua, have a beautiful evening, and hopefully we have some more collaboration to work on in the future.
Look forward to it. Thank you, Rachel. Thank you, everybody. Thank you.
Thank you all. Thank you, Rachel. Bye now.